Yes, my name is Stephanie Ziembicki, and today I'll be talking about occupational diesel engine exhaust exposure measurement and challenges. And this is fundamental to my doctoral thesis. Okay. Trying to go to the next slide. It's a bit of a lag. All right. So diesel engine exhaust is a complex mixture of hundreds of different of gases and particulates created as a byproduct of the combustion of diesel fuel. And amongst the hundreds of different gases in there includes things like carbon monoxide, carbon dioxide, nitrogen oxides, PAHs, amongst many others. And then the particulate matter component of it can be um, named depending on, like, I guess, who your audience is. On the environmental side, they may say particulate matter of 2.5 microns or less, ultrafine particulate, elemental carbon or organic carbon if you're on the occupational side, but they're all relating to the particulate matter component. But there's also other sulfates and PAHs and organic compounds that are adsorbed onto the particulate matter, as well as various metals and trace compounds in the exhaust too. So it's a big chemical soup. It's like that. I have to go through this way. So compared to gasoline engine exhaust, diesel exhaust is more fuel efficient. The combustion of the fuel itself emits less carbon monoxide and carbon dioxide, which makes diesel-powered machinery preferred over gasoline-powered machinery when working in enclosed environments, such as in underground mines and tunnel construction. Diesel-powered machinery is also more fuel efficient than gasoline-powered equipment overall. However, due to the heavier hydrocarbons present in the diesel fuel and higher operating temperatures and pressure within an internal combustion engine for diesel exhaust, for diesel fuel, they emit more particulate matter with PAHs and other organic carbon compounds adsorbed onto the particulate matter, and as well as more nitrogen oxide compounds which are from the reaction between ambient oxygen gas and nitrogen gas in the tailpipe. There's different factors that can affect the composition of diesel exhaust itself. So the fuel composition, like the sulfur content in the fuel, biodiesel also can affect the composition versus regular diesel fuel. The type of machine, the size of it, and the purpose that it's used for. These different machines may have also different compositions in exhaust. And then various engine characteristics relating to how they're maintained, the age of the engine, what tier of engine it meets. These all can affect the exhaust itself, as well as the distance of a worker to the source can affect the exhaust that they are exposed to as well, like in terms of its composition. And these are all information mostly based on the tailpipe aspect of the exhaust. And we are able to remove more of the particulate matter component using particle traps and filters. The exhaust itself, its composition has changed over time. So the particulate matter component to diesel exhaust is quite variable, but proportionally there's more elemental carbon or inorganic carbon versus organic carbon. And there is more particulate matter released from engines with very limited to no emissions controls. And the most recent engine standards, Tier 4 standards, these engines have been seeing emissions of elemental carbon as low as 13%. And these, again, are based on the tailpipe aspect of the exhaust. It may not be entirely reflective of worker exposures. However, most engines in Canada do predate the most recent emission standards, as these only affect new purchases and not existing machines in there. And there's evidence maybe that the changes in the composition may contribute to changes in the health effects, but there isn't enough evidence right now to say anything definitively. It's definitely an area that needs more research. Which relates to my first poll question. So in 2012, the International Agency for Research on Cancer classified diesel engine exhaust as which group? All right. So about 72% of people have responded. I'll give like another few seconds to respond. Right. And there. So the poll's ended. So the answer is group one. I can show the results, I guess. All right. So most said group one, which is correct. Um, so I thought I'd go back to the other one just as a talk about it. But yes, it is group one, carcinogenic, with sufficient evidence for lung cancer. Then my second poll question is, what Canadian industry has the most workers exposed to diesel engine exhaust? And this is in terms of overall numbers. It's a much tighter poll, so it's more interesting. All right. So most did say, 37% said transportation, and that is correct, which I will go to in my next slide. I'm just going to close that so I can see my slides. Okay. So this is a graphic from Carrick's Canada, and Carrick's estimates the prevalence of exposure to diesel exhaust in Canadian workplaces. And this is based on 2016 census data. And most workers are exposed to low levels. I'd probably start by saying that about 1 million workers are exposed to diesel exhaust at work. And most of them are in the transportation industry. That are the two top bars are transportation there. So in terms of overall numbers, they have the most workers exposed, but they're mostly exposed at low levels. Mining also came up in the poll, and they have the most workers exposed at very high levels, or about half of the industry is exposed at these very high levels. And then construction appears as this intermediately exposed group, but also in terms of numbers of workers between mining and transportation. Overall, 5.3% of the Canadian population, working population, is exposed to diesel exhaust, and the prevalence of diesel engine exhaust exposed Canadian workers increased 8% from 2006 to 2016, which is likely due to an increase in jobs in the construction industry, transportation, and warehousing. So diesel engine exhaust has been associated with several acute health effects. I wanted to highlight this one study that just came out last year from Denmark, and it looked at recent exposure to diesel engine exhaust, and it was associated with an increased risk of acute myocardial infarction or heart attacks. We're seeing a 55% increased risk, which is a high quality study, and especially outside of cancer, there's not many very high quality non-malignant studies for diesel engine exhaust. So it's something I really wanted to highlight there. But then there's been other more symptomatic health effects noted. I'm sure everyone is familiar being by the road and a big transport truck drives by and you're left in the wake of its exhaust. And so irritation of the eyes, throat, and bronchi, exacerbating allergic responses, and nausea, phlegm, and coughing. And then cancer. So yes, in 2012, the International Agency Research on Cancer, IARC, reevaluated diesel engine exhaust, and they upgraded its level to group one. So for sufficient evidence for lung cancer and limited evidence for bladder cancer, the Uh, Most lung cancer cases have been attributed to low diesel engine exhaust exposures, and these are very common in the workplace. So in that figure I showed earlier, where a lot of workers, most workers are exposed to low levels, this is a pretty large public health, has a huge public health impact. Regarding bladder cancer, the association has mostly been observed at very high levels of exposure, but the association between diesel exhaust and bladder cancer is much less understood. Evidence from animal studies has shown that it is the particulate matter component of diesel exhaust that is associated with cancer, and it's believed to be the organic compounds adsorbed onto the particulate matter being metabolized into the body. Um, and the estimated annual burden of cancer was done, work was done by the Occupational Cancer Research Center, and they estimated about 560 lung cancer cases and 200 bladder cancer cases are estimated to be diagnosed every year due to diesel engine exhaust exposure. In terms of the non-malignant health effects, there's been um, less studies looking at these chronic diesel engine exhaust associated diseases, especially in an occupational context. Most of the research we do have comes from environmental research looking at traffic-related air pollution, of which diesel exhaust is a major component. Which leads to the main focus of my presentation was how do we measure diesel engine exhaust and what are the challenges of each method? And so there are many different exposure assessment methods that are available in occupational epidemiology to approximate true exposures. However, these methods vary in their informativeness of a worker's true exposure history. So here I'm going to provide an overview of the different methods that can be used to assess occupational occupational diesel exhaust exposure. So it can be a bit of an overview for those who know this very well. So I'll go over the pros and cons of each method, existing challenges of each method, a Canadian example where possible, and then what can be done to improve occupational diesel engine exhaust exposure measurement for epidemiology. I'm going to spend most of my time talking on the first two, direct air sampling and job exposure matrices, as they were the focus of my thesis. Which leads to the third poll question. So NIOSH 5040, it details the personal air sampling strategy for diesel engine exhaust using what exposure surrogate? Right. So most people said elemental carbon, and that's correct. That NIOSH 5040 measures the diesel particulate matter component of diesel engine exhaust, and it uses elemental carbon as its surrogate of exposure. Total carbon can also be calculated because the method itself calculates organic carbon, and then elemental carbon plus organic carbon equal total carbon. But the method, as we are specifically sampling for, is samples for elemental carbon. So I will first talk about direct air sampling in general. So this involves personal or area sampling to provide the most detail on the exposure level for individual workers and to minimize exposure misclassification. For diesel exhaust, mostly gases have been measured historically, such as the nitrogen oxides and carbon oxides. But since the 1990s, the most commonly accepted surrogate of diesel engine exhaust exposure is diesel particulate matter measured as elemental carbon. It is the inorganic component of the diesel particulate matter, and it's been suggested as the most specific surrogate of exposure for diesel engine exhaust, and the one that shows the strongest association with cancer. It's less likely to contain interferences from other workplace sources of particulate matter, such as cigarette smoke, wood smoke, or traffic-related air pollution, which would have a lot more organic carbon. However, elemental carbon is not specific to only diesel engine exhaust and can be present in gasoline and propane exhausts. Direct air sampling in general is time consuming. It's resource intensive. I probably don't need to tell you all this. And you need that engagement between workers and workplaces in order to collect a good number of samples. So this is the front page of NIOSH 5040. It was last updated in 2003, and it uses thermal optical analysis with flame ionization detection using elemental carbon as its analyte. It's the most cited sampling method in any occupational population, construction, mining, but it doesn't specify the required size fraction of the particulate matter to sample. But respirable elemental carbon is the recommended as the most relevant for health effects. Respirable elemental carbon is sampled using a cyclone, correlates highly with total elemental carbon cycled using a total cassette for both area and personal samples, with correlations being around 0.9. And then I have an example of I like this one. Well, this was my study in my thesis, but it includes recent diesel engine exhaust exposure data in Canada, where there is really not a lot of recent data available for diesel exhaust. And it also uses a determinants model to show what you can do with personal diesel engine exhaust samples in epidemiology. So this study, we collected 149 samples with exposures ranging from below the limit of detection to more than 50 micrograms per cubed elemental carbon. And we noted that current exposures were lower than seen in previous decades, yet most exposures were still above recommended health-based limits. So this is important for evidence-based prevention efforts to know what current levels of exposure are, especially in an understudied industry like construction. But personal diesel exhaust exposure samples can also be used in predictive modeling techniques, such as determinants of exposure modeling, which assesses different workplace factors that have the potential to either increase or decrease predict exposure in order to predict personal exposure. So in this study, we used a mixed effects linear regression model to identify key determinants of exposure in construction. We identified two, being work grade, which is defined as either being above ground, below grade, or underground work, and the use of enclosed cabins on machinery. I like to point out that the adjusted R squared, which identifies how much of the variability in the model is explained by the determinants. And for us, it was 72%. So that is astonishingly high, actually, for just two determinants. And the highest exposures were observed underground and in unenclosed cabins. So statistical modeling and algorithms can also be used to reconstruct past exposures based on information extracted from historical workplace measurements. So I don't have a Canadian example for this to the extent that was done in this study, which is an American study, the diesel exhaust and miner study. So where they used personal diesel engine exhaust as respirable elemental carbon measurements. So they reconstructed past exposures using recent exposures and historical measures of carbon monoxide and many other things. The challenge was to provide historical levels of elemental carbon to workers in 8 mines when there was no data available of respirable elemental carbon on these workers. They did have a lot of gaseous data like carbon monoxide, nitrogen dioxide. So they took a baseline survey of personal and area samples of different components of diesel exhaust, including respirable elemental carbon and carbon monoxide, in order to assign baseline measurements of elemental carbon to worker groups. They then investigated the relationship between current elemental carbon and carbon monoxide levels in these mines. And they liked carbon monoxide because they had so much more data of it compared to any other of the surrogates measured. And they did find that the two were highly correlated in their baseline survey. So using that, they were then able to model historical exposures for workers by building an algorithm that was based on historical carbon monoxide exposure and many other factors, including the start of the dieselization in the mines, horsepower of engines, ventilations in the mines, and task-specific characteristics. So it's a very sophisticated exposure assessment. Here I have the front pages of the 5 papers detailing the exposure assessment that I tried to explain very briefly. It's really probably the most complicated piece of exposure assessment I've ever seen. And they've used this then to estimate lung cancer mortality and many other diseases. So to show what the collection of exposure data can be used for epidemiology. Moving down or moving along is the use of a job exposure matrix. So often exposure data are not available or unfeasible to obtain for large studies. So other exposure assessment tools or sources need to be used. So a job exposure matrix systematically assigns exposures to workers by their industry, occupation, or both using standardized codes. A worker's job is known to be a key deterrent of their exposure in EPI, regardless of their work location. So the exposure of a truck driver in one industry is going to be very similar to the exposure of a truck driver in another industry. They can be developed using various sources of data. You can use measurement data in order to build the GEM. You can go to workplace employment records, self-reported occupational history using questionnaires, or applying expert judgment. So I should define what expert judgment is. So it's a technique by which occupational hygienists or other professionals apply their expert judgment in order to estimate exposures, especially to assess the applicability of existing exposure data or to fill in missing data gaps. However, these exposure estimates may then be subjective and misclassification of exposure is possible. Misclassification of exposure is when classifying workers like as exposed when they are unexposed, or misclassifying the level or intensity of a worker. Each data source, like listed here, has its own strengths and limitations, and the choice of the data source, it depends on data availability of an agent. For diesel exhaust, we don't have a great amount of exposure data, so much research has been focusing on other ways of other sources of data. And detailed specific data sources provide strong evidence in order to base exposure in a GEM, which improve the confidence in the exposure assessment. So a limitation of GEMs is that they can't account for all the within job variability that can exist for a job. So it assigns an average level of exposure to workers with a job code, but there's going to be workers who are on the edge where that's where the misclassification of exposure may result. So job exposure matrices are very time consuming to develop, can take years, but they're very efficient at assigning exposure in large scale epidemiology studies once they are made. Which leads to my 4th poll question. So job exposure matrices can estimate worker exposure quantitatively, semi-quantitatively, qualitatively, or all of the above. Okay, so yes. So most people said all the above. Yes. So GEMs can estimate exposure using any of these. It just depends upon the data that was used to build the GEM. So here I have all the diesel engine exhaust specific gems I could think of. If you can think of any more, I would like to know as well. And I've divided them as being either qualitative, semi-quantitative, or quantitative. I'll start with qualitative. So here I have the Carrick's diesel engine exhaust, Carrick's Canada diesel engine exhaust job exposure matrix, which is an expert assessment based gem, and estimates of exposure were based on occupation and industries of workers. I'll elaborate a bit more on the Carrick's and Carrick's based gems on my next slide. I'd then like to go to quantitative, which is based mostly on measurement data with a little bit of expert judgment or to fill in gaps. So it assigns an exposure, like for example, like micrograms per cubed elemental carbon to each job code. So the first one I have here is the diesel engine exhaust job exposure matrix, which is used in the Synergy study. The Synergy study is a population-based case control study based on pooled data from 14 European countries and Canada. It was recently used by Calvin Gu and colleagues in 2020 and to estimate lung cancer and the effect with smoking. But for the development of the gem, they assigned for all job codes, they had more than 4,000 occupational elemental carbon measurements. For jobs that did have measurements, the mean exposure concentration was directly assigned to those jobs. And then for the jobs that they did not have measurement data, exposure concentrations from similar occupations with measurement data were assigned using expert decisions. So the assignment of exposure is predominantly based on measurement data. The next one, unfortunately, is also called diesel engine exhaust gem. It doesn't have a specific name. It's just called the gem right now, but it was developed in this study by Nils Plateau and colleagues in 2020. And it's also an elemental carbon-based gem. It used a similar approach to reconstruct historical elemental carbon exposures, like the diesel exhausted miner studies, why I wanted to mention that one. But it uses historical nitrogen dioxide exposures in order to make current elemental carbon measurements. Then I have FinGem. So if the Finnish job exposure matrix is another quantitative gem, but it uses NO2 as the indicator of exposure for diesel exhaust. And NOCA-GEM, the Nordic Occupational Cancer Study job exposure matrix, uses the same template as FinGem. Then in the middle, now we know what qualitative and quantitative are. Semi-quantitative uses information from both expert judgment and measurement data where available. Burden Gem and Deck Gem, I will elaborate with Carrick's because they are descendants of the Carrick's diesel exhaust job exposure matrix. And CanGem, or the Canadian job exposure matrix, is another Canadian gem. It's based on it's a Canadian gem based on job history info collected from case control studies. And then the Dom Gem is a Dutch gem based on expert assessment and measurement data as well. So the Carrick's gem was developed. It was the first instance of it. It was there in with Cheryl Peters in 2015, and is a qualitative gem that assigned exposure based on the occupation industry of workers. So workers were assigned high exposure if they worked in underground mines, moderate if they had work repairing or maintaining diesel powered equipment, so like a mechanic. And then low was assigned to those that worked with or near diesel powered equipment, so included bystanders exposures as well. This gem, however, gems based on expert judgment or measurement data are limited by the information available at the time of the development of the gem. So with diesel exhaust, after it was reviewed by IARC and reclassified to Group 1, there had been a lot more exposure studies and awareness of diesel exhaust and a hazard. So it became this extra source of information of all of these field studies coming out of diesel exhaust. Along that, Joanne Kim and colleagues at the OCRC used the Carrick's gem in order to estimate the burden of lung cancer associated with diesel engine exhaust exposure, where they assigned quantitative ranges to the qualitative exposures of the original Carrick's gem. And this was based on the ACGIH's withdrawn threshold limit value of 20 micrograms meter cubed elemental carbon. So the purpose of that study was to estimate burden of disease. And then I revisited the GEM itself to include measurement data and to use it for a different purpose to see if it can be used in an epidemiological context and estimate worker risk. So I included measurement data from the published literature since it was last looked at, and then again assigning quantitative ranges to the qualitative ones. But I did not touch the prevalence estimates of these. So Burden GEM and DEC GEM, which is the diesel exhaust in Canada job exposure matrix, represent incremental improvements to an existing job exposure matrix, just a way to move from qualitative to semi-quantitative. Well, I should also mention that the exposures for about 12% of job groups in DECTRIM increased in its update. So CanGEM is another Canadian job exposure matrix. It was developed using job histories from 4 case control studies in Montreal, and which then experts estimated exposure based on 4 metrics: the presence, the intensity, frequency, and confidence in the assessment. It provides mean and median estimates of exposure, which are stratified by job, industry, and time period, for more than 250 agents. The diesel exhaust GEM itself is called diesel engine emissions and has exposure information coming from more than 31,000 jobs. And there's been many publications of CanGEM. Right. For the next 3 exposure assessment methods, I'll go more briefly over them. There's not much about them that's specific to diesel engine exhaust in particular. There's more, so I'll speak mostly on them in general, and just a very brief instance in the literature where this type of method was used. So case-by-case expert assessment is when you assign exposure based on a subject's occupational history, and the information for experts to make their assignments comes directly from study subjects rather than employers. So then this knowledge is then supplemented with reading the published literature. So when done well, findings are valid and they can be agent specific. However, job by job expert review has been criticized as a sort of black box assessment because the rationale for exposure decisions are rarely defined. Transparency can be an issue. So it can vary, like, so there's can be variable amongst experts. Transparency in exposure assessment in general is a known issue. However, there has been some work into making that exposure assessment decision more transparent, and ideas such as there's one called OC ideas, which helps to automate according to a set of objective rules to make that exposure assessment in something like case-by-case expert assessment more transparent. So case-by-case expert assessment is not as efficient as using a GEM. It is time consuming and is not very scalable as compared to a job exposure matrix. So an instance in the literature is this one. I have this one from 2025 looking at occupational exposure to engine exhaust and prostate cancer risk. This is a population-based case control study conducted in Montreal, having more than almost 2,000 prostate cancer cases. The sociodemographics, lifestyle factors, and a detailed occupational history were collected during in-person interviews, and then industrial hygienists conducted evaluations of the intensity, frequency, and reliability of exposure to engine exhausts. Employment records can also be used to as a source of information to assign exposure. They can provide the occupation and the industry of a worker, and they can provide either ever employment in a job or even the duration of the employment. However, past employment in industry only provides information on potential exposure, as workers within the same job title could be exposed to many agents, but at different intensities. So an elevated risk in a job can only be interpreted as a suggestive risk for specific agents. Also, if some individuals in a job are exposed to a particular agent, its effect can be masked or elevated if no elevated risk is observed in the heterogeneously exposed job group. So here I have an example from 2004. We're looking at diesel engine exhaust and ischemic heart disease mortality. So 7 Ontario construction unions participated in this study and they provided information for each subject, including the start and the last date of the trade. They collected deaths from the Ontario Mortality Registry, and they used past employment as a heavy equipment operator as a proxy for diesel engine exhaust exposure. And the last one I was going to talk about is self-reported exposure and job history. This can provide also the occupation and industry of worker, providing either ever employment in the job or the duration of the employment. However, it's generally accepted that exposure assessment must be blind to disease status, but this may not be feasible for self-assessment of exposure. However, when supplemented by other occupational information about potential determinants, it can provide a useful starting point for expert assessment. Once again, the reliability and the validity of information can also be highly variable between studies, and misclassification of exposure is possible whenever we're not collecting exact exposure information, exposure measurement data. It's also very time consuming and not very scalable for looking for very large scale epidemiology studies. I have an example from 2018 looking at exposure to gasoline and diesel engine exhaust and the risk of kidney cancer. Kidney cancer cases were identified using provincial registries, while controls were identified from random digit dialing in provincial administrative databases. Then self-reported questionnaires were used to obtain information on lifetime occupational history and cancer risk factors. And two hygienists then blinded to case status, which is great. Coded occupational histories for diesel and gasoline engine exhausts using concentration, frequency, duration, and reliability. Great. So then general challenges for exposure assessment for diesel engine exhaust in its use in epidemiology. So some of these are specific to diesel exhaust, but most of them are widespread for basically all agents. There is very limited exposure data that we do have for diesel exhaust, and especially data as elemental carbon. And the consequences of having missing data include increased subjectivity of exposure estimates and a higher likelihood of exposure misclassification, especially if there is little to no workplace records in order to aid researchers. And then I touched on briefly about how the multiple surrogates of exposure have been measured over time, and that there's potential interferences from other non-diesel engine exhaust sources of exposure. Administrative databases, such as like medical records, registry data, or death certificates, are predominantly used in population-based studies to obtain information. However, limited to no occupational information, such as job title or employer or industry, are available in these records. So other sources need to be used, such as claims data. And the limited employment records, especially outside of mining and transportation, provide a particular challenge for diesel exhaust. I'm thinking mostly about construction, which is a very challenging industry to study because diesel exhaust, because the construction is basically a patchwork of small businesses, and collecting workplace records from that would be an extreme challenge. Right. There's also been a reliance on qualitative terms in order to characterize diesel exhaust exposure in the past, being like a dichotomous exposed, unexposed metric. But this is more likely than to have misclassification of exposure. And some unique challenges that have popped up when studying diesel exhaust exposure is that there's mismatches between exposure assessment tools like GEMS and disease data sets. And with that, something like a crosswalk is needed to translate the occupation industry codes from one system to another. So crosswalks, which identify all matches between systems, are available from Statistics Canada or other government organizations. But there's very little guidance of actually how to do this. And there exists this challenge of when one code in one's data set matches with multiple codes in the other data sets. So historically, these one-to-multiple matches are trimmed down to just a single one-to-one match, but you're going to be losing exposure information, which may lead to then having exposure misclassification. So right now it's like exposure information, disease information are often siloed. And then exposure assessment tools to assess diesel engine exhaust themselves are becoming outdated, mostly based on manual or expert judgment-based methods. So how do we address these challenges for diesel engine exhaust exposure measurement? So I wanted to share some of my own work in this field to show what's currently being done in research to address some of the challenges that I've mentioned for diesel exhaust. So this was the focus of my doctoral thesis, and this is the title of my thesis, Improvements in Exposure Assessment Methodologies for Diesel Engine Exhaust Exposure. And I tried to address many of these challenges at various levels of exposure assessment. So the first was the collection of recent exposure data in Ontario construction workers. I touched on this briefly earlier in my presentation, but the lack of diesel engine exhaust exposure data in general poses a huge challenge for exposure assessment in research. But since IARC reevaluated diesel exhaust to group 1, there's been much more data with that, and the study did also contribute to that. And then I used all of these new field studies and harvested their published measurement data in order to update the diesel exhaust in Canada job exposure matrix to move into more being semi-quantitative and to align it with our current understanding of exposures in different industries now that we have more measurement data available. Once it was updated, I then crosswalked it over to the codes used in our disease data set, which is the Occupational Disease Surveillance System. And to do that, I also used a rules-based approach to systematically crosswalk exposures over from one system to another. So I don't have a reference for this right now because it's currently accepted at Occupational Environmental Medicine, will come out soon. And then the gem itself, we tested it with lung cancer to see if crosswalking over a gem works, and as well as to see if Carrick-based gems can be used for epidemiological studies in this for this purpose. And we assessed it with lung cancer as a known causal relationship. So exposure and disease no longer being siloed. We then estimated incident risks of cancer and chronic disease in Ontario workers, and workers being identified using workers' lost time claims that were then linked with various administrative health databases, such as the Ontario Cancer Registry, emergency department visits, physician billing records, and hospital discharges. So, with that, we're assessing exposure on a multi-level exposure metric, moving away from the dichotomous, moving more into the multi-level. However, there's always more to be done, and what we can do to improve exposure assessment for diesel engine exhaust. So number one is definitely the collection of more exposure data, and especially in very understudy groups outside of mining and transportation, where we do have most of our data coming from right now. And that can help to further quantify the existing exposure assessment tools for diesel exhaust that we do have. And the collection of more Canadian data would be a huge asset. And then moving into the second point of moving this data then into exposure databases, such as the Canadian Workplace Exposure Database, which currently has no diesel exhaust data as elemental carbon. And there's also work ongoing at OCRC to create an exposure database for several agents. We could also improve workplace record collection, which would really help for looking at industries besides like mining, where we have it's much easier to do this, but to move away from doing more average exposure measurements, then maybe being able to calculate cumulative exposure. And then, as what's sort of fundamental to my thesis, was using these rules-based approaches to exposure assessment in order to make the whole idea of exposure assessment much more transparent and reproducible. So to cap off my whole presentation, It's important to know that epidemiological exposure assessment is time-consuming and often not transparent. And high-quality exposure assessment is also very resource-intensive, expensive, and researchers often must balance the need for specificity in exposure assessment with practicality and feasibility. But research has shown that stronger, more specific exposure assessment tools do result in stronger epidemiological results. And poor exposure assessment quality does tend to water down risks, and which may potentially lead to missing worker risk entirely because of the more misclassification of exposure. So it's important to understand the pros and cons of each method and consider how each affects the overall research quality. So all the methods that I've identified here could lead to the overall goal of improving the transparency, efficiency, objectivity, and reproducibility of exposure assessment for occupational diesel engine exhaust exposure. And I would be happy to take any questions.